34-year-old healthy patient came to see me. She had been on a course of ciprofloxacin for 10 days, and she came to see us because her symptoms were ongoing. Her condition was different, and it's a different talk called bladder pain syndrome. Nonetheless, I was just thinking about this, ciprofloxacin as first-line therapy for a bladder infection. And then I realized a lot of my primary care physicians and especially urgent care centers give ciprofloxacin as first-line therapy, or Cipro. It's almost like urgent cares will give it out like candy. Now, is that, and some pharmacies, it's like dirt cheap. It's not even expensive. But is it cheap? Does your body have to pay the price? Absolutely. The Infectious Disease Society of America states that ciprofloxacin should never be given as first-line therapy. This is across the board with American Urology Association, European Association of Urologists. All of them state that ciprofloxacin is not first-line therapy. Most women have uncomplicated cystitis. They have never had a bladder infection, and this boom, it just comes out of nowhere. And they are overall healthy. They should not be put on ciprofloxacin. Why? Because ciprofloxacin has significant concerns. Number one is it can rupture the tendons in your legs, and now you're walking with crutches, for who knows, a month plus. Or it can affect the bowel, and you may land up with Clostridium difficile enterocolitis, and you are in an isolation ward at the hospital. It's not even worth it. Yes, in some cases, ciprofloxacin would be indicated, but that's totally different. Uncomplicated cystitis, there are far simpler and very effective antibiotics that should be administered, and that is what we do in our practice. We see what the patient's story is. If it's uncomplicated cystitis, it's just 3-day or 5-day course of a simple antibiotic, or even one powder dose, and that's it. That's very important to understand what is the infection, why is it happening, what's the overall history, and treat appropriately. Ciprofloxacin almost never as first-line therapy.